And we're back in this season of the Patient No Longer podcast. We're going to continue to discuss and debate some very interesting topics, including the customer experience and customer engagement itself. That's what we'll be digging in today. I am joined today by Jeremiah Todd. Jeremiah, hello.
Hi, it's a pleasure to be with you today.
Well, thanks for coming in, Jeremiah. I'm excited to talk to you about this, and you've got a great role. I can't wait to dig into this title a little bit. So you're the VP of Customer Engagement, Experience, and Language Access at Fairview Health Services in Minnesota. Fairview Health Services is an industry-leading, award-winning nonprofit offering a full network of healthcare services in that great state. But I got to ask you about this title. So language access, I don't think I've seen that in a title before. Can you tell me what that means?
Yeah, for sure. So our health system has really been invested in our approach to health equity, and so I think this is part and parcel to that. And we didn't really have a comprehensive strategy as a health system for how we are going to best serve our population that doesn't have a preference for English. And so we have a language services department that really exclusively focuses on spoken interpretation. But what we lack is the broader strategy and plan around language access. So how do we handle translations? How do we potentially think about AI enablement of something like translations? How do we take advantage of our multilingual staff to offset some of the demand for interpretation? And that industry has shifted dramatically since COVID. So for example, all of the interpreters have to register with the state of Minnesota. And so before COVID, there were about 2,000 registered interpreters that were willing to come on site for services. Post-COVID, there's 200. Right, so the supply has shrunken dramatically, and we're reliant now on virtual interpretation as a primary way that we provide those services. And so how we maximize and balance our resources is of strategic importance. And Minnesota is an incredibly diverse place. We had over 150 different languages that we translated and had to interpret for in our system last year. So just incredible opportunity there.
I think there's a misnomer about Minnesota. So I'm an upper Midwest guy. You're an upper Midwest guy. We're together in that sense. And I'm close enough to know. I mean, there is a coalescing of so many different groups and so many different cultures. And what we know at NRC Health is when people bring that to the patient experience, it affects the patient experience. It makes it different. And you know our mission. We've talked about this before, about human understanding. It's something we're talking a lot about in this season. I know it's something you believe in, but just building off of that first answer, I want to ask you this broad-based question. When you hear human understanding, what does it mean to you, and what does it mean to the work you do at Fairview Health Services?
Yeah, of course. So we have been on our own journey as a health system to really think about, what do our patients need, what do our patients want in order to have the best experience possible. And so we did about 2 years ago, we interviewed hundreds of patients. We talked to employees, staff, providers, and what we heard was remarkably consistent. That patients, what they really want at the end of the day is to be understood and known for the individuals that they are and have care tailored to that experience. So it's the concept of know me, and then they want to be listened to and heard, and they want to feel confident, not only in their next steps, but confident in the care that's being provided for them. And that aligns incredibly well with this notion of human understanding and the way NRC has been shifting the conversation on that along with others. So it was sort of a natural coming together, and we really have embraced the human understanding. We now ask the human understanding question on our surveys across our health system, and that provides an even deeper level of insight and empowers our staff to really focus on our journey towards becoming an anti-racist organization. So it's been a great evolution for us, and I think important to note that while we were thinking about the patient when we were doing a lot of that, we were also thinking about the employee, because we know that the workforce experience is inextricably linked with the patient experience. And a lot of those things that patients want are the same things that our employees want. And so I think there's a real opportunity there to continue to bridge the gap between those two domains.
That's such an interesting and important bridge to build. I want to come back to the bridge between experiences. We've had some past guests just this season talk about the X in PX, in CX, in EX.
Sure.
And it's so interesting to think about how those bridges can be built and sometimes how they're not. So your journey that you went through as an organization, this learning journey, which we were so proud to be a part of. I think a lot of places want to do that, but then they say, well, I've got my CAPS data. I get some feedback coming in. I'm mandated by the government to do some of it. And so I'll just continue to learn that way. And it's like me with my books that I want to read. They sit on a long list and I don't get to it. Do you think that there was a particular catalyst? I mean, obviously the work you did was important, but if someone was listening to this and said, well, I want to go through a learning journey at my organization, what's a step or two that I can start, a little spark to get that journey going?
The journey towards human understanding.
Yeah.
Yeah. So we've been on quite an evolution from an experience perspective. So, we had, of course, we got to do the CAP surveying, but I think in order to best serve our patients, we have to have a broader understanding of how they feel about their experience with us. And we're still not perfect about that, and happy to talk about that more, especially from a language access perspective. But I don't think we're doing our community right if we don't understand the perspective across the continuum of our care journey. And we're limited by the fact that we were only getting HCAP surveys, which were, 60, 90, however many days delayed till we're getting the results. And then it's hard to take action on those results because it's hard to identify point of cause when the data's, 3 months old.
Yeah.
So that really created the platform and the impetus for us to say we need to understand more. And then we've made that feedback incredibly valuable for our teams. We put some structure and process in place so that people are really paying attention to the data. And so they see value in it, because if they didn't see value in the feedback and we weren't taking action on the feedback, then it would be hard for me to justify spending money to get the feedback, right? So that's where we started, really just making the insights we're gathering valuable, taking action on it, and then communicating back to our patients how we're taking action, because that's how we're going to build trust in the community. That's how we're going to keep people coming back to Fairview.
And it's so interesting, too, in thinking about those X's and thinking about, another thing we talk about on this podcast is people getting trapped within the patient experience. So, I noticed the use of the word customer that you have. You have customer in your title, and you talk about customer engagement. We've had a renewed focus as an organization on customer experience. Talk to me a little bit about that difference. I think people sometimes struggle with, well, aren't patients our customers? And if we just double down on the patient experience, won't that ripple out? What's your take on that? And specifically, how do you approach the need to engage the customer?
Yeah, so that was really intentional on our part. We had patient experience departments, and our system went through a period of integration in 17, 18, and 19. And we had this conversation thoughtfully a lot about, how do we best position this? Because patient is used a lot, customer is used a lot, consumer is used a lot.
Sure.
And I think all three could mean very different things. But we took time to define it for our health system. So people may define it differently. But essentially what we wanted to emphasize is that, across our care system, patient is a word that resonates a lot with the frontline care provider or the EVS worker, right? They see patients day in and day out, and that's what they resonate with most. But someone who's in accounting or human resources that doesn't have that direct connection to the patient, it's really helpful to reframe things around the customer and how do we improve the experience for the customers of the work that they provide. So we're all can think about experience, because if the person in finance improves the experience for the people understanding their line items on their budget, well, that's going to make their job easier to provide a better experience for the patient, right? So how do you help connect the dots across the entirety of the health system so you can get everybody behind improving the experience? And then we're starting to think more and more about our consumers, and in terms of how we engage people that are not yet our customers, right? Because we need to be thinking about them as well, and how we're, again, building bridges in the community, helping create better access to care, especially for underserved populations.
I'm curious in the connection between, as we connect those experiences, part of the lift is to connect those departments within our own organizations, our big, sprawling organizations, and you guys are a large organization. So when you think about the customer, that makes total sense, and I know that's in your wheelhouse. When you think of the consumer, they can be a little less defined.
Yeah.
Obviously, that's a passionate part of what I do and what NRC Health does, and we have a consumer intelligence platform called Market Insights. But a lot of people, even when they're using that and looking at the data, it's hard for them to connect what's important to consumers to then what becomes important to customers. That's a hard lift in general, but for you, are you able to coordinate, to cooperate with marketing, with other folks in other departments where I think sometimes organizations struggle to just connect their own dots?
Yeah. Yeah, we're building those bridges. We have a wonderful relationship internally with our chief marketing officer, and within our organizational structure, I report to our chief digital and strategy officer, and that provides a really interesting connection. I don't know that a lot of experienced departments are positioned in that way, but technology and the use of digital assets is what's going to help us transform. And so having that partnership organizationally to not only think about, the physical experience, but the digital experience and how do we marry those things together has been really tremendous. And then he's really been thoughtful about making sure that our chief marketing officer is really well aligned with the work we're doing. So yeah, we're building those bridges. We have a really good partnership, and that's certainly paid dividends in the work that we're doing. And the other thing I'll add to that is, just thinking about, our brand strategy. We have to live that out internally, and they're mutually reinforcing. So that connection is critical as we do our work, because again, they have to support each other.
I'm so glad you mentioned brand. I'm going to come back to that too, and I want to ask you a brand question. It's kind of a common thread that we carry through this podcast as well. But a burning question for me, and I think it's always on everyone's minds, because you are building these bridges and you're finding ways to look at the patient outside of just the traditional experience and with different lenses that you can pull together into a kaleidoscope of sorts. When you're doing that, let's talk about AI. It comes up in every conversation, so this one's no different. How does artificial intelligence help or hurt the customer experience in the way that you view it?
Yeah, phenomenal question, and I think it's such a fascinating area. Just as an aside, I think about, AI. We're starting to use Microsoft Copilot in our environment,
Okay.
and so very practically, even just from my day-to-day work and starting to use that tool, there's an incredible amount of efficiency it provides, because there's always this sort of overarching fear with AI that it's going to, take jobs.
Yes.
But I think what we have been increasingly thinking about is how does it help us do our jobs even better, right? And that simple example of how I use Microsoft Copilot to help me do the heavy lifting on creating a presentation, right, where it would have taken me hours to do that before, right? Simple example of a little burden relief, not only, and then you think about the burden relief potential of AI, not only for administrative staff, via the example I gave, but you think about that for clinical staff.
Yeah.
And so I think about AI, more from how do we reduce the burden on our workforce and make the right thing to do the easy thing to do. We just have to approach it very carefully and thoughtfully, and reducing burden for our workforce is going to create a better experience for our patients. And then there's, of course, all the ways that, customers, consumers will start to interact with AI or see, the use of AI, whether it's in chatbots or how you search for things, right? We have to make sure that we're paying attention to that in terms of how our customers view Fairview or access services. But again, I think it can only be helpful so long as we approach it, thoughtfully and carefully.
I like the phrase burden relief. I think that if you could figure out how to do that for everyone, you would create a very profitable company. I think we're all looking in our all day-to-days. We have all kinds of different listeners. We've got C-suite folks, we've got managers, we've got folks who are new to healthcare, been in healthcare for decades, and I think everyone wants burden relief. So I'm especially excited about that. I use Copilot too.
Nice.
I found myself on like a Saturday night. This is a little sad to admit. Just like punching stuff into Copilot and using up my boosts or whatever it is, where we see how many AI images we can generate and maybe drop those in a PowerPoint for work. But I always tell people it's AI generated, so it is very new. What's interesting on the consumer side is consumers have told us through our surveys they're excited about AI and how it might help their experience, but they don't feel like they've really been able to point to what it is, and they don't feel like they've had an experience yet where if there was AI, it wasn't really detectable to them. A lot of folks on the other end of the chat don't realize that there's some AI there, or if there's things happening clinically, the AI is being used there. So I think for consumers, they're wanting to see it to believe it. This gets me, though, to a big, broad question that I wanted to open up to you. especially with what you do at Fairview. And that's basically the idea of patient engagement. I think a lot of people, and we have a lot of folks that work within patient experience as listeners, they go into it saying, I want to engage patients better today than I did before. And I think already within that goal, there's an issue when we just look at people as patients. So from your point of view, with this customer idea, this bridge sort of between consumer and patient, what are some things that you've done that others could do to say, listen, I want to engage them no matter where they are, including in the patient experience? We don't want to forget about the patient experience as we talk about consumer and customer. It's easy sometimes to then forget when they're in front of us receiving care.
Right.
Have you found some techniques and ways to tie that together that other folks could use at their organizations?
Sure. And I think this is where the industry needs to go and where there's a lot of incredible growth potential. And just to go back to my overly lengthy title, that's the reason why we put customer engagement in it, because we need to think about the experience holistically and how we're really involving patients in their care journey.
We sometimes assume engagement in the experience, right? You have it split out. Engagement and experience is two different things.
Right, because I think so often we forget about that because we're just paying attention to, well, how did things go 24 to 48 hours after the visit when we do our real-time surveys, or how did things go when we get our HCAHPS results? And that's where a lot of the focus has been, but there's so much other data out there, right? And so how do we really think about how we capture that data in a meaningful way to add to the insights we already have? Because how patients feel about their visit 24 to 48 hours, especially if they love their doctor and they had a really great outcome, right? They're going to be positive about it, but they may have had to wait 4 months to get an appointment on the front end. Or there may have been an issue with their medication. Maybe it was, it took a while to get it, or, they had to get the refill process didn't work quite right. So there's all these like little bumps or hiccups that we don't quite have visibility into. And so thinking about, well, how do we better understand the experience when I pay my bill, or when I'm scheduling that appointment, or is there any friction when patients are searching on the web for services, right? So pulling all that together in a holistic way will provide us greater insights to drive improvement. The question is, have the technology enablement to do that well.
And you guys, as everybody does, sort of struggles with the technology and making it work in the ways that you want, but you don't shy away from it. I don't get the sense from you guys that technology becomes such a challenge and such a burden. I mean, how do you approach the technological part of the customer experience? Do you see it as something you have to overcome as you're adopting new technologies, or do you see it as it's an immediate engagement tool for you?
Oh, I think it's where we have to go. To achieve scale. It's of critical importance. And again, I think that's sort of why we've aligned with our chief digital officer and making sure that that's predominant in our thinking, so that we're marrying, again, the physical and digital experience together.
And that's all part of the journey. So I want to come back to brand. So I think one of the most frustrating things that people experience is within their particular department, maybe those bridges aren't being built. They're doing a great job, but it's only one thin band of the consumer and patient journey, that customer journey. And so they feel a little helpless outside of the box that they're in. Do you think in the work that you're doing that experience work does spread out to the pre and post journey? And if it does, how does that affect the overall view of the brand? Because brand is a big, broad stroke that consumers paint with. And a lot of times they think about your brand before they become a patient.
Right.
Do you feel like that work spreads out into the overall brand, or does it get trapped?
I feel like we've got opportunity there, but I think that's where we have to go, is thinking about, well, how does the scheduling process or the billing process affect our overall brand? Because there's other organizations not in healthcare and some within healthcare that have really figured that out, right? And the ability to access care in a frictionless way is something that we have to get better at, because it will impact our perception of our brand. And then there's all sorts of other connections, like what we're doing in the community and how that shapes our brand. So we have great partnerships with our community advancement team within Fairview. So we're thinking about how that intersects and intertwines as well.
I think sometimes people give it lip service of, we're in the community or we're a community hospital as if it's taken for granted. You guys go way beyond that. And I want to ask you a heavy question about that.
Well, do you mind if I just add one more thing before we
Yeah.
go to the next question?
Yeah, of course.
Just going back to, thinking about language access, I'd be remiss if I didn't just comment a little bit on, our survey strategy, but thinking about it from the perspective of, folks who don't speak English or folks who may not fill out the text message or the email, right? So we have this huge opportunity to improve representation across how we're surveying so that the data we're getting back is actually representative truly of the populations we serve. Because most of our respondents are of certain demographics, and we don't really understand as deeply as we need to the experience of a Somali patient or someone who speaks Karen in our community. So we're doing a lot of work to try to understand that in a more meaningful way, because the solutions aren't necessarily there yet to do that effectively, and it needs more time and attention to make sure that we're understanding the needs of those communities.
Those communities and all comprised of different individuals that speak different languages and have different perspectives, and I love your focus in on that, and that would be very true to human understanding.
Yeah.
And the question around, were you treated uniquely as you, central to us. So I've got one more heavy question as I alluded to, but I'm going to keep it light for a minute. We have a speed round.
Okay.
You don't know this because we spring this on every guest. And so these are light, easy questions. I mean, hopefully easy. I guess that's up to you. But we're asking these of every guest this season.
Sure.
So trust your gut.
Okay.
Just go with what comes to mind first. Dogs or cats?
Cats.
Okay. Beach or mountains?
Ooh, mountains.
Okay. Morning person or night person?
Night.
Night owl, just like me. Favorite TV show of all time?
Wow.
People struggle with this one.
Well, there's so many choices.
There is.
True Detective Season 1 comes to mind for me.
That is up there for me, season 1 specifically.
Yep.
And last one, San Diego or LA?
I haven't spent a lot of time in San Diego. I like what I've seen so far here. Went to LA a lot growing up, so I'm gonna have to go LA.
It's okay to say LA.
Yeah.
Yeah, it's all right. Okay. Well, you did great through the speed round.
Cool.
So I want to come back to, I've got 2 more questions for you. I want to come back to the health equity piece. So we mentioned Minnesota. Whether people remember it or not or know it or not, it was an epicenter for COVID going on, the murder of George Floyd, the protests that ensued. And we've talked to so many clients, including Fairview, about how difficult it was to deal with all of those things coalescing together. Mm-hmm. Now we're a couple years removed, and we talked a lot about health equity in 2020, 2021, 2022. I personally have seen it sort of fading a little bit from, the agendas, if you will. It's not for us. But I'm curious, what do you think about in the aftermath of that? Was there progress made then? Is there still progress made now? Or are we kind of, chasing our tail a little bit on this topic of health equity?
Yeah, well, thank you for bringing that up. I mean, it was certainly an interesting time to be in Minnesota and experience all that, from the protests surrounding George Floyd. It happened right as COVID was going on, and so there was just a tremendous amount of challenges. But I'm incredibly proud of the way our organization has responded and continues to respond. While we may hear rumblings of efforts around this waning, our organization is doubling down. We founded, it's called the Hope Commission. It was a joint effort between the university and our partnership with the University of Minnesota and the University of Minnesota physicians, called the Hope Commission. So we brought leaders together from throughout the system to really put together a long-term comprehensive plan for how we were going to become an anti-racist organization, and do that not only within our 4 walls, but think about how we do that in the broader community within Minnesota. And I think a very tactical evidence of that is putting an emphasis on things like language access, and thinking about how we infuse health equity throughout all of the work we do, instead of having it be some siloed thing that we do somewhere else. So a great example of this is the representation work I already talked about within our surveying. So that's a very intentional partnership with the health equity team that we have. And by design, that health equity team is very small because the intention was to infuse it throughout the entirety of the organization. So we're always making decisions with that lens in mind, whether we're talking about workforce engagement or customer experience, quality and safety, you name it, we're thinking about how that impacts health equity.
And when you do it that way, I think patients and future patients can feel it in the different parts of what they do. And the language access is such an interesting dynamic of access. We focus so much on wait times and throughput and not on such a common foundational thing like language, where if there's a barrier, nothing else matters.
Yeah.
It truly breaks it down. You've seen a lot, you've lived through a lot, especially in Minnesota. So I think this will be a particularly poignant last question. And that is, you're getting into an elevator at work next week. Someone else comes in, it's their first day in healthcare. This is day one in this industry. Short elevator ride. What's a piece of advice you would give them on their day one?
Great question. I would say to never forget why you got into healthcare in the first place. That purpose and passion I think we all have for why we get into healthcare is something that we don't talk about enough. But it's the fuel that keeps us going. And it's why people get into healthcare in the first place. So I'd say, despite all the stuff that's going to happen, the meetings, the day-to-day, don't lose sight of why you're in healthcare and why you stay in healthcare.
Well, I can tell that you have not lost sight. And so it's great to have people like you, not only as partners of NRC Health and Human Understanding, but just in healthcare in general. The industry needs more Jeremiah Todd. So I want to thank you very much for joining us today.
Yeah, thank you. This was great.